Hi, I'm Vic Veer. I'm an ENT surgeon working for the NHS in central London. And I want to tell you a little fact about tonsils that a lot of people don't seem to realize. Tonsils reduce in size as you grow older. Now, I don't know why people don't seem to realize this. And a lot of people think I'm lying at this point. There are loads of studies that prove that tonsils, when you're younger, seem to get smaller when you're older. I had quite big tonsils when I was younger, and now you can barely see my tonsils. They slowly regress in size. There are X-ray studies and MRI studies that show that when you're younger, the size or the volume of the tonsils is this big, say, and when you're older, they're not just this big and you're bigger around it. They are actually smaller. They regress in size. You don't need them so much afterwards. Now, this isn't just an interesting fact, it is really useful for us as doctors clinically. We often know because these tonsils reduce in size as children get older, it changes the way we manage people with large tonsils. So, if, say, a child with very large tonsils with evidence of sleep disordered breathing, meaning they sleep rather poorly at night with their big tonsils, and if they're, say, 4 years old and they're really struggling, they seem to have obstructive sleep apnea, typically we'd say, look, your child has obstructive sleep apnea. They're only 4 years old. It's likely to get bigger over the next 4 years. If they can't tolerate it now, they can't cope with it now. We ought to take it out now rather than making them wait until they're much older. However, if they've got to the age of 14 and they've got tonsils which were a problem, but not so much of a problem as they were previously, they seem to be getting smaller anyway, and would go, maybe we should just wait. And hopefully the tonsils will regress by themselves. We don't have to operate on those children because we're hoping that the tonsils will reduce and go away. So knowing that tonsils shrink with age, particularly at the age of puberty, helps us give a more nuanced approach to our management of children with large tonsils. There is a little caveat to that, that if you keep having tonsil problems, particularly chronic tonsillitis, where you keep getting infections, or even it's just stones and things like that inside your tonsils, people with these problems seem to have large tonsils that stay and remain with them even until adulthood. So some people say, I don't know what you're talking about. I've got huge tonsils. I'm 31 or something like that. And my tonsils are fine. I don't have any infection. But when you go in there to remove those people's tonsils and you hold on to tonsils, all this sort of horrible stuff comes out. I've actually got a video on my YouTube. I think it's 18 plus because it's horrible, where a normal looking tonsil, you hold on to the tonsil and all this stuff pours out. That person never really had infections before. I think so. I can't remember exactly. But I see this a lot. A lot of people with big tonsils as adults don't realize they have chronic infections, but they actually do. And only when you grab the tonsils and all this stuff pours out, do you realize, oh, this is just a chronic infection. That's why they still have big tonsils. Having big tonsils as an adult is abnormal. And I think it's interesting that a lot of people don't seem to realize that. It's not to say, however, that all adult tonsils that are large should be removed. If you've got big tonsils that aren't causing lots of infections, aren't bothering you, aren't causing you snoring and sleep apnea issues, there's no need to have an operation. I don't think you should rush out to go and get your tonsils removed. But it's just an interesting fact, and it helps us understand what to do in patients with these problems. If you want to know more about this, I've got my book. This is a cheeky plug. Read my book. I've got it available as an ebook at the moment. I'm hoping to publish it on Amazon soon. So go to the link in the video description below. You can buy it there. I think it's $6 or something. Anyway, thanks a lot. Do take care. Bye bye.